Good afternoon, San Antonio. I'm your mayor, Ron Nirenberg, and I want to talk to some of our younger residents about COVID-19, which is short for Coronavirus Disease 2019. Maybe you've heard a lot about it on the news, and some of it may even appear to be kind of scary. But while this is something that we need to take seriously, we don't need to be afraid. Yes, some people might be pretty sick, but scientists and doctors think that most people will be okay, especially children. Those same doctors and scientists are working around the clock to help us stay healthy, and they've suggested a few healthy habits that we can all try to slow the spread of the virus. If you have a cough or a sneeze, try to do it into a tissue or even into your elbow. If you use a tissue, make sure you throw it away right away. Make sure you keep your hands away from your eyes, your nose, and your mouth to prevent any germs from entering your body. This one's my favorite. Make sure to wash your hands for at least 20 seconds, which is about as long as it takes to sing happy birthday twice. When washing your hands, make sure that you follow these 5 steps. 1, get your hands wet. 2, make a lot of bubbles. 3, rub your hands together. 4, rinse with water. And then 5, dry your hands. Make sure they're completely dry. Soap is this virus's greatest enemy, so washing your hands is very, very important. Make sure to keep things clean, and if you feel sick, tell your parents and try to stay home. So what does COVID-19 look like? It can look different in different people. People can have a fever or a cough, or sometimes they have a hard time taking breaths. Most people who have gotten COVID-19 haven't gotten very sick. In fact, most doctors say that children don't seem to get very sick at all with COVID-19, while a lot of adults might seem to get sick quite a bit. Most of them, however, all get better. But if you do start to feel sick, it doesn't mean that you definitely have COVID-19. People can get sick from all sorts of things, and I know the pollen is in the air right now, and I'm feeling my allergies today. Just remember that your parents, your grandparents, your teachers, and other adults in your life are there to help you feel better, and they can get what you need. These are different days for all of us, including your parents and your grandparents. Nobody is to blame because nobody experienced anything quite like this. And that's okay, because we all are in this together. You might miss your friends and your classmates. I know I do, and I know they miss you as well. So reach out to your parents in your school to find ways to talk to them. If you can, just give them a call, even if it's just to say hi. Our city will be so much safer, cleaner, and healthier because of what we have learned in the coming days, or what we have learned and what we will learn in the coming days. So remember to wash your hands, stay home, and stay safe. Now, it gives me great pleasure to introduce a friend of mine. Her name is Justice Luz Elena Chapa. And what you should know about Justice Chapa is that she serves on the 4th Court of Appeals. And she's not only a judge who serves on the appellate court and grades other judges' papers and presentations, she's also a mom of three kids. And unfortunately, Justice Chapa, about a month ago, contracted the COVID-19 virus. And she, unfortunately, has been trying to get better. It's been a difficult process. She thankfully is on the mend, but it's been a very difficult thing. In fact, Justice Chapa hasn't been able to hug her family or even sit at the breakfast table in quite a long time. And I believe, Judge, that you're on day 30. So welcome, Judge, and thank you so much for joining us.
Hi, Mayor. Hi, everyone. Thank you for watching. Hi, kids and parents. And I'm here via Skype in my bedroom at home.
Judge, how are you feeling today?
Well, I'm actually feeling incredibly strong, and thanks to all the prayers and doctors, and I've been following all the guidelines very strictly. You'll still sense a little bit of raspiness in my voice. I normally don't have this deep a voice. Thankfully, my fever is gone for almost a week now, and yesterday I received some incredible Easter news from my doctor. I tested negative on Friday. I took another COVID-19 test. And I'll get swabbed here again this afternoon, and hopefully the second test will also come back negative so I can come out of isolation from my bedroom because I haven't hugged my family or my kids, and well, today's 30 days. And so I'm ready to get back at it.
Well, we are keeping you in our prayers, Judge, and have read about the process. And when people do get sick, some people do take a long time to recover. And you're on day 30 now. So tell us how you got sick and what it's been like to be in quarantine. Do you know when you'll be out?
Well, that's the million-dollar question. But what I would like to mention to all of the kids and families, this virus affects everyone differently, and so each case is taken on its own merits. And so I've been following doctor's advice very closely. I first became sick on a ski trip during spring break, and it was a Saturday evening when we landed in San Antonio, and very late that evening is when I first started to see signs and symptoms of extreme pain throughout my body, and then later a high fever came, and so I immediately contacted my doctor on Sunday that following day, which was March 15th, and on Monday I went in for a flu test and strep test. They both came out negative, and I then met the criteria to get a COVID test, and unfortunately within about 48 hours, I knew that the test was positive. I have shown a variety of symptoms. The ongoing fever has come and gone throughout this process, and that's what's mainly kept me in isolation. I wanted to make sure that my family was safe and remained healthy, but also my community as well. They've remained in quarantine and stayed at home throughout this process, and I in my bedroom. And luckily, I want to share this, is that we've had incredible evenings together. I luckily have a glass door in my bedroom, and my husband has been superhero dad, and I'm not sure how he's managing it all. Sorry, getting emotional. Trying not to be. But any event, we've had dinners together every night through the glass door that leads out to the patio, and so I sit on the other side of the glass, and they sit at the table, and we get to share dinner every night together. So that's been one of my saving graces, and has given me incredible peace every evening.
So, Judge, you are a super powerful mom. What's it been like not being able to hug your children, so how do you get by in the evening? Are you able to communicate well through the glass door? I mean, how are y'all being able to do simple things like homework at night?
Well, my daughters are 15 and 12. Luz Elena is 15 and Natalia is 12, and Jose is 5 years old. So they all have their each set of demands and challenges, and the girls are on autopilot, and they're very self-sufficient and independent, and I'm really incredibly proud of them. Jose, being 5 years old, he requires a lot more attention, so my husband Miguel has been juggling his work and his legal work from home. And so all three kids are conducting their classes via Zoom, and they've adjusted fairly well. I think that we all have experienced all of the emotions imaginable, some new emotions, and others we've experienced before. We've been scared at times. We've been filled with hope because of all the prayers, but there's also been lots of laughter and smiles, and that's truly what has gotten us through this. And I think that families experience all types of challenges, and we've of course have never imagined us being in this situation, and we didn't choose to be here, right? And so everyone, kids, it's for me, it's been like a very, very long time out. Even though I feel like I did nothing wrong.
Yeah. Well, we're
But
grateful for you, Judge, and you were thankfully not having to go into the hospital, I believe, right?
correct.
Okay. If you have, so do you have any advice for kids whose parents might be going through this, and maybe even for the parents who have to be isolated from their kids for a time?
Well, I'll say this. Again, this has been only because of my personal experience. We all have to work as a team, right? And if you all play sports, you know there's a captain, you know there's a coach, and you know there's players, teammates. We all have to play those different roles at any given time. Kids have to work together. Siblings have to work together like they've never have before, trying to keep maintain rules and regulations, I guess, at home. But it's hard because we're all under a bunch of stress. Some kids will play the role of coach, other kids will play the role of captain, and other kids will play the role of teammates. And same with parents. Sometimes I'm following my children's lead because they too are empowered by how we handle the situation. And I know that there's hope if we all work together and we show kindness and love and patience. Because this has been a long process, and I'm not so sure when it's going to end, but we will get through this. I know we will.
Yeah, and I do have to say, Erica at home, who's working from home, and Jonah have both been great teammates. Jonah's been making sure to get some of the chores done and keep the house clean, and Erica's been playing not only her role at work, but also mom, but also cook. And there's so much more burden placed on families right now because of the circumstances. But everybody, as you said, is playing a role and being part of a team. So it's great inspiration, Judge, and we're glad that you're starting to feel better. I know there's a lot of kids out there that have sent in some videos and questions, and so how about we start answering a few? And so I think we have our first question is going to be from, we have two questions that were somewhat similar. The
Sure.
first one
Right.
is from, let's see, I think we have James and Camila. So let's roll their questions.
My name is Camila, and I'm 4 years old, and when schools are going to be open. Mayor Ron, when is Corona going to stop, and when can I go back to school?
Well, so both of those were fairly similar questions. So I want to say first thank you to Camila and to James for asking the question. And I'm sure that this is something that your kids have been asking as well, Judge, which is when are schools going to be open? When is this Corona going to go away and schools are going to be open? So the schools are actually controlled by superintendents and the board of trustees for each individual school district. In the Bexar County area, there's about 16 different school districts, but they've been all working together to make sure that they are closing and opening at the same time. In addition, the governor has said in his emergency order just a couple of weeks ago that schools will remain closed till at least May 4th. But right now we're waiting for the guidance from the local school districts to give us a sense of when they're going to be open. So for right now, stay put and get used to your homeschool. Judge, do you have anything you want to add to that?
Well, I know my kids are incredibly anxious to get back to school and see their classmates and teachers, and our lives are going to take a while to get back to normal, but it'll be a new normal. But what I recommend is that we all stay patient and take one day at a time, and not look too far ahead into the future, because then we're not focused on the present, and that's each other and making sure that we continue to show each other kindness so that we can get through this.
Yeah. But what we can guarantee you is that there's no school, or that you're not going to school tomorrow, but make sure you get up on time to finish your reading and to do your homeschool assignments. Make sure you stick to that school schedule so that when school does start back, whether it's in May or it's sometime after that, you're not so unprepared for that early wake-up call. Okay, now let's go to Ava, who has a question.
If a person coughs in a store, can it travel to other aisles?
So Ava was asking if someone coughs in a store, can it travel to the other aisles? And so, Ava, this is a great question, because one thing that you've probably been hearing us talk about is something called social distancing, where we're asking everyone to stay 6 feet away from strangers. If they don't live in your house, stay 6 feet away from people, whether you're outside or you happen to be in a closed environment like a store. The importance of that is because when you cough or you sneeze, droplets sometimes come out of your nose or your mouth, and that's what actually carries the virus. And so if you're standing far enough away from someone, if they happen to cough, you're very unlikely to catch that virus. The other thing that we've asked people to do is that if they're outside or they're in a store or something like that, is to wear a mask. And I have one in my pocket I carry with me at all times. It looks like this. You can make it out of cloth, but it's something you can put over your face like this, and you see people wearing them right now. And that's because it not only prevents you from breathing in something that's coming out of someone else's nose or mouth by accident, it can also, if you happen to sneeze by accident, it keeps it from going out into the air. So the good news is, if you stay 6 feet away, you're very unlikely to breathe in anything, and you take all those proper precautions like we talked about at the beginning. Right, Judge?
Absolutely. I know it's kind of funny to see so many people wearing masks, but know that it's for your protection and for their protection as well. And it's challenging not to go to the grocery store as a family. I know it is, because we all like to go to the grocery store, and it's a family outing. But right now we're experiencing some very challenging times, so we need to stay at home as much as possible, and designate maybe one parent to go to the grocery store and leave the kids at home. And I know that sometimes parents do have to take the kids, so make sure that you're wearing your masks. And even if you're wearing your mask and you sneeze, cough in your elbow, because those droplets, Ava, can get to other aisles and remain there for some time. And so just wear your mask and think of it as an adventure.
Yeah, that's a good point, Judge, because sometimes if the droplets do come out, they might stick to something, and then you might put your hand on it. So that's really why it's so important that if you go outside or you're someplace, that you wash your hands afterwards, because you don't know what you've accidentally touched. The other thing that the judge said, which is also very important, is that if you don't need to go with your parents to the grocery store, stay home. Only one person, if possible, should go to the grocery store. That allows there to be more space in the store so people can keep 6 feet away from each other. But it's mask season, so make sure you wear your mask, and you can also make it out of cool patterns so that it's not so boring when you wear a mask. It doesn't have to be just a plain old mask. You can make it out of your favorite fabric. Okay, now let's go to Lucas.
Hi Ron, my name is Lucas Colon and I am 9 years old, and I am wondering if we can ride our bikes out in quarantine.
Thank you for your question, Lucas. The answer, Lucas, is yes. You can ride your bike out in quarantine as long as you have your parents' permission, as long as you're riding safely. And don't get fooled. Just because there's not a lot of cars out on the street doesn't mean you don't have to observe all the safety rules. But we do encourage people to go outside, get some fresh air. But after you're done with that, and after you're staying 6 feet away from other people, come back home. We don't want you out there too long. We want you to come back home after you get the fresh air. Judge, do your kids ride bikes?
Well, they like to run and walk, and in all honesty, the tires on our bikes are flat right now. But love to play tennis, so I understand that it's incredibly important for our emotional and mental health that we get outdoors and breathe that fresh air, and maintain safe distances when you're on trails. And also, even if you're outside, make sure you continue to cough in your elbow. And if you have a little bottle of sanitizer, it might not be a bad idea to also take it when you go walk and on your trails or ride your bikes.
Yeah, it's so important when we're all kind of cooped up at home right now that you go outside as much as you can and get some fresh air and stay 6 feet away from people, but then come back home. Okay, we have a question now from Eduardo.
Hi, Ron. I'm Eduardo, and I'm 11 years old. I'm wondering if you know why everybody's taking all the toilet paper from the stores.
That's a great question, Eduardo. And I think there's going to be many book reports written about people taking toilet paper from stores during coronavirus, this pandemic. Judge, why don't you answer that one? I got to think about that one a little bit more.
Oh, gee, that's too much pressure for me to answer this question.
I want a verdict on the toilet paper today.
You know, I'm not sure what goes through people's minds, but I do know that people were buying toilet paper and paper towels in record numbers. And luckily, we're blessed to have a grandmother who's been staying at home this entire time. But when we were on our trip, she went to the store and stood in line and stocked our home with enough toilet paper. So I know that and wow, this is a tough question. I'm not sure how to answer it. It's probably the most challenging one.
It is, and I don't think there's a good answer for it. In fact, what we've been reminding people is don't hoard anything. Don't hoard toilet paper for sure, but you don't really have to go out and buy everything off the store shelves because the stores are still open. They're important services that we have. We have to keep, the family, the household running, and so stores are open and there actually is a supply of everything available. So we've been telling people stop panicking when you're in the store because those products are going to be there when you come back next week. The important thing, though, is to make sure there's enough for everybody, that we're sharing, and you only buy what you need. But I'm with you, Judge. I don't know if there's a really good answer for the toilet paper, but this is we just have to remind people there's not a shortage of toilet paper if everyone just calms down and buys only what they need. So we'll keep thinking about that one, Eduardo. But if you have any thoughts on that too, please let us know. Okay, there's a question now from Robert.
Hi, Mayor. After this coronavirus pandemic, how are we as the city of San Antonio going to prepare for another pandemic like this?
That's a great question, Robert. And let me start by saying right now we're in a period of uncertainty because this is called COVID-19, which again is short for coronavirus disease 2019, which was when it was first discovered. And that means it's also a novel coronavirus, which means that it's brand new. We hadn't seen this one before, so there's a lot of research underway, and we're learning a lot as we go along. But one of the things that I think we're going to be better prepared for as a country in the next pandemic, whenever that occurs, and mind you, pandemics only occur every 100 years on average. At least that's what the conventional wisdom is. But what we have to do is continue to be working with our partners around the world to understand these diseases and be prepared with testing so that more people can get tested faster. And that also we prepare our communities for the things that we're seeing, like the shortages or the grocery stores, and have rules prepared for those just in case that we need to use them. Judge, what do you think?
Well, I certainly hope that we don't experience another pandemic in our lifetime. But I will say this is now part of our story, and we are each our own author. And so it depends. How do you want to write your story at home? Maybe you should keep a journal and write down your thoughts on the good and the bad and the ugly. What have been the pros, what have been the cons, and I know that if we give all of this a positive spin, we will one day look back and be incredibly proud of ourselves for surviving these unnerving times. But perhaps you all want to write a short story and come up with your own ideas. You will feel absolutely empowered and feel like you have some control during this time.
That's a great idea, Judge. And Jonah, if you're watching this, I think that's a great idea too, and I would love for you to start writing a journal about this experience, because people are going to grow up with this as part of their history. The other thing that I think we can be prepared for next time is that everyone needs to have better access to things like the internet, because so much of the work that we're doing right now, schools, for instance, is on the internet, and we know a lot of our communities don't have that kind of access, and we're working to make sure that they get it. But there's a lot of things that I think are going to change for the better as a result of the coronavirus and COVID-19. We did get a question written in, and actually several questions written in that are similar to this one right here, and I'll go ahead and read it now. This one is from Angelica, and she asks, how do people get the virus? Because I don't want my parents to get it. And we talked a little bit about this, Angelica. So people get the virus, COVID-19, because they are sick and they transmit it to somebody else. It's similar to any other kind of illness like the flu or something like that. It's contagious, so people pass it on. They pass it on through the droplets that come out when they sneeze or they cough. Or they leave those droplets somewhere else and someone touches them and then they touch their face. So that's how the virus is spreading. And so that's why we're working to make sure that people have the proper precautions. They're washing their hands, they're wearing masks, they're staying 6 feet away from people. And all of this is work to make sure that we stop the spread as the researchers and the scientists and doctors develop new drugs that can treat it, because that's not what we have currently. Judge, do you have something to add on because you're a parent experiencing this now?
Well, I want to say this. At the time that my family and I traveled to Utah for spring break, there was not a reported case of COVID-19 in Utah or in San Antonio. And at the time, the precautionary measures were to wear masks and gloves if you can, and wash hands on a consistent basis. And if you're traveling via airplane, wipe down areas, tables and chairs with Clorox wipes. And despite my following all of those rules, wearing gloves and masks and wiping down areas, I still became infected. And so, our abiding by these precautionary measures will keep us safe. This virus is incredibly contagious, and we need to make sure that we continue to follow all of these precautionary measures and make sure that we don't feel like this is an overreaction. Wearing masks will become the new norm, and it'll be okay.
Yeah, and we will get through this. And so I think we have time for maybe one more question, and I'm going to read a question that represents several others. In fact, let's see, Diana, Virginia, as well as Shelby, and Noah also all asked the same general question, which is, how long is this stay-at-home thing going to last? I miss my parents, or I miss my grandparents, I miss school, I miss my friends. How long is this going to last? And this is a really great question to all the kids who asked this. And what I can tell you is that it's going to be a little while longer. What we're doing right now is doing what our doctors tell us to do, which is that we've got to limit the spread of this virus by keeping our social distance, by making sure that we're not going out for things that are unnecessary, that when we do go outside, it's for fresh air, and then we're coming back. We're trying to do that right now so that we can limit the spread of the virus and that we can start going back to school and enjoying our lives soon, very soon. But right now, all the doctors in our community, some of them work at the city, some of them work at our universities, some of them work at the hospitals, are all working together to figure out when we can start coming and opening up schools and things like that. They're working in the same way at the state and also throughout the country, trying to figure out when's the right time. But if we do it too soon, then we can potentially see more people get sick, and we don't want that to happen. So be patient. is going to pass. We're going to get back to our friends and our families and school and homework very soon. But in the meantime, make sure you wash your hands and do all the things that your parents are advising you to do. Judge, how do you?
Well, I know that we all miss our extended families and our friends and our teachers, and I miss my work colleagues also, and all the people who I work with. But we just have to remain patient. And I think that if we kind of remove the focus from when is this going to be over, perhaps that'll bring some peace within our homes. And if we're focused on the present, one day at a time, then when those stay-at-home orders are lifted, it'll be a huge surprise, and we will all be, incredibly excited to go see our friends and get back to school and the old normal activities that we used to partake in. But for now, just enjoy your family and think of creative ways to make this somewhat of a fun experience. I know that there might not be any fun aspect to any of this, but we really do try to have to do our best to be creative and empower one another to enjoy the time that we get to spend together. And perhaps we'll come out stronger, more unified at the end of this experience.
And it's a great time also to use your imagination. There's great books that I'm sure that you haven't been able to open yet because there's just no time with all the activities of the day. But now you have a little bit of time to read. Now you have a little bit more time to maybe spend with your parents talking about things, maybe pitching in with some of the housework, or even making a surprise dinner for your parents one day. But there's a lot of ways to get through this patiently as the doctors work to make sure that we can come back to normal or come back to our friends and family as quickly as we can. But the doctors are going to continue to work with us to make sure that that's at the right time. Well, Judge, thank you so much for joining us today, and thank you, kids and parents, for tuning in. Judge, we're so grateful for you and your service and the work that you do, but also especially grateful that you are a mom on the mend.
Yes, sir. I'm thankful too. And Mayor, let me say this: your leadership has been extraordinary under these dire circumstances. I'm incredibly proud to live in San Antonio. I have such great peace of mind that you and Judge Wolf are at the helm. I know your city council members and your commissioners court. You're doing everything each and every day for our protection and for our safety. Our promise to you is to remain patient, to stay at home, and you know us best. Our local leaders know us best. Thank you for your leadership. And I also want to give a shout out to all of the doctors, nurses, and staff who are manning this. We are staying at home for you, and we want everyone to come out stronger, more positive, and we will be an incredibly united community once this is all over. Thank you, Mayor, and thank you all for watching.
Thank you, Judge. Thank you, everyone, for watching. And don't forget, thank the doctors and the nurses and the firefighters and the police officers, all the folks who are still out there working that are in these the jobs that can't stop. We want to thank them also. So we'll see you maybe next time. In the meantime, we are in this together. We're going to get through this together and enjoy a little bit of time at home. See you all next time.